reaching St. Lucia's only 100% digital television station, Hot 7 TV.
Viewers, and welcome to another episode of The Wellness Hour. I am Delphina Vuna, your host for today. The Wellness Hour is your trusted source for health and wellness information, brought to you by the Ministry of Health, Wellness and Elderly Affairs with Hot 7 TV. The Wellness Hour is sponsored by the Caribbean Development Bank and Interdevelopment Bank. Thank you so much for joining us for another episode. I am so happy to be here today. We will be talking about diabetes. As you know, this month is Diabetes Month. Last week, Ms. Onika McCoy did introduce that to you, and we had our wonderful guest, Dr. Sear, giving us an introduction to diabetes management here in St. Lucia. So today we will continue with that discussion. I encourage you to stay with us, invite a friend to listen with you. And I must say thank you to Onika and the Hot 7 team for keeping up the show. I have been watching, even though I haven't been here, and we have really had some really excellent programs in the past couple of weeks. So as usual, before we get into our discussion today, just to let you know what has been happening at the Ministry of Health. First, we will take you to the discussion with Dr. Sear and the statement given for observance of World Diabetes Day, which happens to be tomorrow, November 14th. So let's take in a clip from that.
Every year, World Diabetes Day is recognized globally on November 14th. This year's theme, Diabetes and Well-Being, underscores the importance of ensuring that individuals living with diabetes can lead healthy, fulfilling lives with equal opportunities for happiness and well-being. Diabetes mellitus, or diabetes, is a chronic disease which is characterized by higher than normal levels of blood glucose or blood sugar. As the condition progresses, damage to the organs such as the heart, kidney, nerves, and blood vessels occurs. These complications affect the quality of life of persons living with diabetes and can also lead to death. An estimated 90% of people who have diabetes are diagnosed with type 2 diabetes, which is the most common type of diabetes. The good news is that type 2 diabetes is preventable and can be controlled with a healthy lifestyle and adequate medical treatment. Healthy lifestyle changes, which include commitments to things such as keeping physically active, avoiding smoking and alcohol, maintaining a healthy and balanced diet, losing weight if overweight, and taking care of your mental health can all make a significant difference in the management of diabetes. This year, the Ministry of Health is pleased to provide an additional platform which can be used to help everyone prepare healthy meals. The new campaign, My Plate, a Healthy Plate, with the slogan, Building a Healthier St. Lucia, One Plate at a Time, provides an opportunity for individuals to learn and use creative ways of preparing nutritious meals with locally grown produce. Look out for the engaging live cooking demonstrations on various television stations. On this World Diabetes Day, we remind everyone that living with diabetes is not a barrier to leading a full life. With proper education, healthy lifestyle practices, regular monitoring, and appropriate medication, diabetes can be managed effectively.
Dr. Sear there tying in for us our series on the healthy plates, and if you missed any of those, be sure to catch the reruns on the Facebook pages of the Ministry of Health, Wellness and Elderly Affairs or Hot 7 TV. Very informative information there, and as you can see, very relevant as we look at management of our chronic conditions. So also happening, we just want to inform and give some information on an alcohol awareness competition that is being presented by the Substance Abuse Advisory Council Secretariat, SACS, a division of the Ministry of Health, Wellness and Elderly Affairs. They are targeting the youth and who will get an opportunity to express their views on the misuse of alcohol. So let's take a listen to that.
The Substance Abuse Advisory Council Secretariat within the Ministry of Health, Wellness and Elderly Affairs has launched a national poster competition aimed at empowering young people between the ages of 11 and 16 to creatively express their views on the misuse of alcohol and the risk associated with its abuse. It will allow for taking into perspective the growing concern of alcohol misuse and abuse across communities, families, and young individuals. Since traditional research among this age group can be challenging, the competition offers a creative way to capture young people's perspectives through their own artistic expression. The coordinator of the Substance Abuse Advisory Council Secretariat, Mrs. Natasha Lloyd Felix, outlined the objectives of this national poster competition.
The idea is twofold. One, that the content that is generated from this poster competition can be used for products targeting that very population. So the products would be more relatable because they will be coming from the youth themselves, be it brochures, be it educational content, be it any imagery associated with educating youth on alcohol. In addition to that, for us, more even importantly, is that it will allow us to get the voice of young people. Given that we have limitations to do research, this in itself would give us that insight we're looking for as it pertains to how young people see the current impact of alcohol on our communities, on our families, on individuals, even individuals as young as themselves. So this we see as a photo voice, the voice of young people through photo, through picture, through depictions creatively generated by the young people themselves.
Mrs. Lloyd Felix says this poster competition provides a comfortable platform for youth to communicate their feelings and observations about alcohol use, given their challenges to express their feelings in person.
The hope is that it will open a conversation. Sometimes in talking to youth, it's difficult to be a little intrusive with them to ask the questions. But when they're given the opportunity to express it through mediums that are more comfortable with them, like drawing, painting, it will be a chance now for us to see visually how they see, what are their insights, and how they would express how they feel about it. The poster submissions come with 100-word maximum written content that will give an explanation of what it is that they're portraying, so that too would support us having an appreciation of their view on the subject matter.
So we would have heard Dr. Sear mention alcohol consumption as a risk factor for diabetes and for other chronic diseases also, and of course very detrimental effects for our youth. So I look forward to seeing some of the contributions from them as they tackle this and to see what their thoughts are on alcohol use and how we can kind of, what we can do to stop underage drinking and help them recognize the effects. So as I mentioned, we have a very packed show today. We have a lot to talk about. So we're going to go ahead and take a short break. When we return, we will introduce our guests and get into our discussion. Stay with us.
Industrially produced trans fats are found in fried foods, processed foods such as cookies and chips, hard margarine, vegetable shortening, and some commercially baked products. Avoid the use of trans fats by using fresh, wholesome foods, using natural fats such as nuts and seeds, and unrefined vegetable oils.
This message is brought to you by the Nutrition Unit of the Ministry of Health, Wellness and Elderly Affairs.
You mean I can win a laptop or a tablet or a school bag with supplies?
Are you dreaming?
No, I'm not. It's right here. You can check it for yourself. I need to enter this. I am not missing the alcohol poster awareness competition.
All you need to do is create a hand-drawn and colored poster with the theme Alcohol-free is a great way to be. Include a 100-word description explaining your poster on the benefits of being alcohol-free. It must have no violent images. Think positive. Open to all youth from 11 to 16 years old. Entries must be submitted to the Substance Abuse Advisory Council Secretariat on the corner of High and Jizzle Street or the Bureau of Health Education, Ministry of Health, Waterfront Castries by Monday, November 24, 2025. For further information, call telephone number 468-7921.
Alcohol-free is the best way to be.
Now you can have your deaf announcements and teleobituaries heard on Sundays, right after the church service with Father Albert from the Babano Good Shepherd Catholic Church. That's right. On Sundays, have your deaf announcements and teleobituaries heard right here on Hot 7 TV and Kiss FM simultaneously. Call 452-6040 from Monday to Friday. Call and make arrangements for your deaf announcements and teleobituaries to be heard at 7 a.m. and 1 p.m. Monday to Saturday, and on Sunday right after the church service with Father Albert from the Babano Good Shepherd Catholic Church.
Industrially produced trans fats are found in fried foods, processed foods such as cookies and chips, hard margarine, vegetable shortening, and some commercially baked products. Avoid the use of trans fats by using fresh, wholesome foods, using natural fats such as nuts and seeds, and unrefined vegetable oils.
This message is brought to you by the Nutrition Unit of the Ministry of Health, Wellness and Elderly Affairs.
Trans fats are either naturally occurring or industrially produced. Industrially produced trans fats are made. Look closely in the ingredients list for hydrogenated oils, which would indicate that the product contains trans fats.
This message is brought to you by the Nutrition Unit of the Ministry of Health, Wellness and Elderly Affairs.
You mean I can win a laptop or a tablet or a school bag with supplies?
Are you dreaming?
No, I'm not. It's right here. You can check it for yourself. I need to enter this. I am not missing the alcohol poster awareness competition.
All you need to do is create a hand-drawn and colored poster with the theme Alcohol-free is a great way to be. Include a 100-word description explaining your poster on the benefits of being alcohol-free. It must have no violent images. Think positive. Open to all youth from 11 to 16 years old. Entries must be submitted to the Substance Abuse Advisory Council Secretariat on the corner of High and Jizzle Street or the Bureau of Health Education, Ministry of Health, Waterfront Castries by Monday, November 24, 2025. For further information, call telephone number 468-7921.
Alcohol-free is the best way to be.
Welcome back to the Wellness Hour. I am Delphina Vuna, your host for today. The Wellness Hour brought to you by the Ministry of Health, Wellness and Elderly Affairs with Hot 7 TV and of course sponsored by the Caribbean Development Bank and Interdevelopment Bank. Joining me today is family nurse practitioner Charlene Duncan, and she's here so that we can speak a little bit more about diabetes screening and management. Welcome to the program.
Thank you for having me.
Awesome. So I'm looking forward to have a very active discussion here. I'm sure a lot of people will be looking forward to hearing even more about diabetes. We speak about diabetes very often. Every year we have a whole month dedicated to it. But of course, there are always persons who probably miss something or, are not really listening at the time. And so we always want to ensure we still give the information. So when we look at screening, tell us, what are we talking about when we say screening, and how do we screen for diabetes?
Okay, so in essence, screening involves testing of individuals who are at risk for having a given disease, but they have not yet developed any signs and symptoms. Okay, it aims to improve early detection, and it helps to reduce adverse outcomes for implementing treatment before the disease manifests itself. Now, if you look at diabetes, for example, we try to follow what happens internationally and via the Caribbean. So we usually follow our Caribbean Public Health Agency guidelines for diabetes for screening. And basically what they're saying is that given the prevalence of diabetes and the risk factors, the entire population of most of our Caribbean countries, including St. Lucia, would need to be targeted, and we would need a population-based screening technique. So the International Diabetes Federation, they're recommending the use of a questionnaire. And I'm sure that most of you probably have heard of that questionnaire, and it's called a Find Risk tool. I'm pretty sure that the presenters before me would have mentioned it, but I just want to let you know it's a very simple tool. It basically determines your risk for developing diabetes within the next 10 years. Okay, so in primary care currently, we no longer go ahead doing multiple finger stick pricking for patients anymore to determine whether they have diabetes. But now patients from the age of 18 to 74, we use the questionnaire to ask them various questions to determine their risk for developing diabetes. And based on that, a score is determined. So basically the tool is simple, it's completed in less than 2 minutes, and the results are as follows. So after you ask a series of 8 questions based on risk factors, you find that all of the scores are computed, and based on a range, there is a range for each area of risk. So if you receive less than 7, you will be considered to be at low risk. 7 to 11, you have slightly elevated risk. 12 to 14, moderate risk. 15 to 20, high risk, and greater than 20, you would be at very high risk of developing diabetes within the next 10 years.
Okay, and I think here we can see on the screen some of the questions that are part of the Find Risk assessment that will be done for the patient. So just a few simple questions and also some investigations.
Yes, so basically based on the results of your Find Risk score, that would determine what to do next. So the decision is based on an algorithm, which is also evidence-based, based on our CAFA guidelines. And what would happen is that based on your age, based on your score, and also based on the value of your lab values, like your glycosylated hemoglobin, which is HbA1c for short, or your fasting blood glucose, that will determine what we do next, as to when next to screen, how often you screen, and so on.
Okay, and just to elaborate, so just for persons listening and for those who may not be certain, you mentioned HbA1c, so that is a blood test that we would usually do both in our screening and as well as in the management of persons with diabetes. And basically what that does is, as Ms. Duncan indicated, we don't always go about doing the finger stick. So it's one blood test that we do usually every 3 to 6 months that gives us a broader idea of what the the blood sugar is in a patient over a longer period of time. So what that does is body versus when we do a one-time finger prick that tells us what's happening at that particular point in the body. So we can use that test to help us make the determination of persons who are diabetic, as well as whether those who are already on medication or treatment are actually being in the target range for proper management, right?
Right.
Okay. So we saw here that fine risk score, and that is something that is done in our wellness centers for our patients?
Yes, in every wellness center, this is what we use to determine your risk for diabetes. Rather than coming in and you getting your finger prick, persons are anxious, they're afraid of the prick. And so we're letting them know that there is a simpler tool now, non-invasive, inexpensive, simple, and we're encouraging everybody who has not yet been screened to visit your nearest wellness center to be screened for diabetes. Especially this month, that's the best month, the month of November.
So we know we have 34 wellness centers, as well as our urgent care facilities, our polyclinics. But persons might be thinking, is that something that you can just walk into the facility and get done? Do you need an appointment? How does it work? Who does the assessment for you? Just so people are comfortable and they know what to expect when they go to the wellness center.
Okay, so the process is very simple. So when you walk in, you get registered for whatever clinic you came to, be it antenatal, be it for you came for just to do your vital signs, be it you came to see the obstetrician, you came to see the OBGYN. We incorporate the screening in the vital signs assessment. So apart from getting your blood pressure checked and your weight and your height, we have well-able trained individuals. We have our community health aides, our nurses who are well-trained to interview you with the 2-minute questionnaire. You do not have to make an appointment. You just walk in and you are administered the tool. Wonderful. Once you have not yet been screened, because the first question we're going to ask you, have you ever been asked those questions before? And if you say no, then we will go ahead and ask your permission, and we will find out questions related to your risk.
Wonderful. For persons listening, some of us may already know there are certain things that we would look out for to say what we say are the signs of diabetes. Now, usually we do the screening because we want to pick this up before there are any signs. But for persons who may be experiencing symptoms, what are some of those early things that they could see that should, really prompt them to go in and get checked?
Okay, so most commonly, some of those signs would be frequent urination. So you notice that more than usual, you are going to the toilet to pee. And you have not drunk so much water for the day and you just go in several times. Also, you notice that you develop this sudden excessive thirst, and no matter how much water you drink, you're just feeling thirsty, and that can be one of the signs. Also, unexplained hunger. So despite having had a meal, you just realize that you're hungry again, and you realize it's happening to you very often. You notice that you have not been exercising, you didn't change your diet, but you just started losing weight. Also, some other signs that we have noted is that sometimes women come complaining of frequent yeast infections. And that may be a sign that maybe you are having some glucose intolerance and your body is in a phase where it's trying to balance the glucose, and that might be a sign. Also, you have persons who get frequent fungal skin infections. They call that LOTA. They come most of the time saying that they've tried to take care of that rash, and it keeps coming back and it keeps coming back. That would be a good time to do the screening to see whether you actually have a high risk score, and that we can take it into do further testing for you. But these are some of the major signs, considering all other signs, but these are the major ones that you would want to look out for.
Okay, thank you so much for that. So definitely, if you are experiencing any of those symptoms, you would definitely want to go into one of your wellness centers and get checked. We also know that there are certain things that put us at higher risk for developing diabetes. Let's just touch on some of those things so that persons, can know what they need to be aware of and if any of those apply to them.
Yes, most certainly there are some risk factors that we need to consider, and some of them are factors that we can change, and there are some factors we cannot change. So some of those that we cannot change, some of them would include age. So persons over the age of 40 years old would be at higher risk for developing diabetes. Having a first degree relative with diabetes mellitus, like for example, you have a parent who had diabetes, a grandparent, or siblings with diabetes. The fact that our ethnicity, that we come from African descent and some Asian descent as well, are at higher risk for developing diabetes. Also, persons who, when they were pregnant, they were diagnosed with gestational diabetes, or they gave birth to an infant that weighed more than 4 kilograms or greater than 9 pounds. That is also one of the risk factors. And in the past, when you did your blood sugar, somebody told you, the doctor told you, or the person who did your blood sugar said to you that your blood sugar is high, and that has been said to you prior. So these are some of the risk factors that we cannot change, but they are certainly risk factors for developing diabetes. But we move on to other risk factors that we call them modifiable factors that can actually change. And we consider that to be if you're overweight or obese, meaning that you have a BMI of greater than 25 kilograms. And we're also looking at the waist circumference. And for females, we're looking at a waist circumference less than 31 inches, and for the men, less than 35 inches. And we're also looking at factors where we are not active, physically active, we don't exercise. All of these are risk factors that can increase your risk for developing diabetes. And these are some of the risk factors that you can actually change if you want to reduce your risk.
Wonderful. So, Ms. Duncan, given that, you know, a lot of those things we cannot change, for example, we cannot change our race, we cannot change the fact that we all are going to get older over time and eventually will be at risk. I'm sure the majority of us have a relative and very likely a first-degree relative with diabetes. What are some of the things that we can do to prevent ourselves from developing diabetes? Some of us may have heard the term pre-diabetic. So, you know, sometimes we tell persons that they are pre-diabetic. If you are in that stage or even before that, what are some of the things that we can do to prevent the further development of diabetes?
Okay, well, first of all, I think based on our family history, most of us, as you said, would probably have a first-degree relative. And coupled with the fact that we cannot change our genes, but there are some things that we certainly can change. And we want to speak of lifestyle change. And lifestyle meaning that activities that you would do to actually help reduce your risk for developing diabetes. Because certainly doesn't mean that because you actually have a family history means you will definitely develop diabetes. And so small changes like increasing your water intake, walking, exercise, ensuring that you have enough rest, all of these, like reducing stress, all of these are some examples of how you can certainly reduce your risk. Our diet has a lot to do with our risk for diabetes, the way we portion our food, and I think our nutritionists would probably give us some more insight into that. And these are some of the things that sometimes we start them, but we are not consistent. Because you know, I mean, we all riled up to start a change and then eventually we fall off the bandwagon. So there is need for consistency and discipline to ensure that we can maintain that lifestyle change so that we can either prevent it or control diabetes.
Yes, and especially if you're at the point where, you know, you're not diabetic or pre-diabetic, or even if you're pre-diabetic, I always say small changes in moderation will give you a bigger impact than just trying to do everything overnight.
Right.
That usually is not very successful because it's a radical change for your body. And somehow our brain works in that it feeds off the sugar. So the more sugar you consume, it's almost like when you don't have it, you feel like you're craving it. So sometimes we have to, you know, gradually do those changes in order to be able to maintain it over a long time and to actually see the results of it. So just before we go to a quick break, Ms. Duncan, I do apologize. I didn't give you an opportunity to, you know, tell persons a little bit about what you do as a family nurse practitioner. So we'll go ahead and do that now.
Okay, good morning. For those of you who know me, you know me as Nurse Duncan, but I am actually a family nurse practitioner. I am employed in the Ministry of Health, I work in regions 5 and 6 that spans from Vieux Fort region all the way to Soufrière. And basically my role entails, I am basically an advanced practice nurse who has been trained in areas of management of chronic conditions and general medical conditions in terms of screening for it, diagnosing it, and managing and treating those conditions and providing health education, health promotion activities. And there are about 9 or 10 of us on island. Most of us are found in various regions. So you will get a nurse practitioner for region 1, region 2, 3, 4, 5, 6, 7, 8A and B. And we are spread throughout the island, and you can access our services at the various wellness centers. We work alongside our physicians. We work with a team of other healthcare professionals. And so I'm very excited to be here with you this morning.
All right, wonderful. Thank you for that. So just before we go to break, we'll go ahead and go into our weekly wellness tip for this week. So as we go through for the weekly wellness tip this week, I wanted to ensure that we speak a little bit about diabetes, since we are doing Diabetes Awareness Month. And one of the things I wanted to highlight was hidden sugars in our foods. So one of the things that we might say, you know, I don't eat a lot of sugar, or I don't put sugar in my tea, or, you know, I don't eat cake. So these are the foods that we know obviously have sugar, but there are lots of sugars hidden within our foods. And as you can see here, some of those come from our condiments, our sauces, so things like salad dressings, ketchup, barbecue sauce. Sometimes you see honey barbecue sauce, so that honey is sweet, right? So that means sugar. Some of the things you can look for when you read your labels, you will see a line with that says added sugars. So you want to ensure that this is not like a significant portion of the overall nutritional value. And also in your ingredient list, words that end in OSE, O-S-E, like fructose, and those will give you an idea of how much sugar is in there. We want to be mindful of our portion sizes, and of course with the MyPlate, a healthy plate, we know what our portion sizes should be, how much we should be consuming our vegetables, fruits, our protein, as well as our carbohydrates. And choosing whole foods over processed foods will always give us better nutritional value. And one way we sneak in a lot of sugar is with our drinks. So a lot of you may buy what you think is juice, but if it's not 100% juice, chances are it has a lot of added sugar. A lot of the box drinks that we give our children, we need to be very mindful with those. Some of them are not actual juice, they're juice drinks. So these are even more processed and contain even more added sugars. So we need to be careful about those hidden sugars, you know, things like flavored yogurts and all of those. You tend to have a lot of added sugar. One thing I think like we can do, you can get like plain yogurts and you add your own fruit. You can add a tiny bit of honey for a little bit of sweetness, but a lot of time the fruit has natural sweetness that will flavor the yogurt for you. But when you buy the already flavored ones, it usually tends to have much more sugar. Using things like your ketchup and your salad dressings, and, you know, in moderation, not splattered all over, because there's a lot of hidden sugars in some of those foods. So we want to be mindful and pay attention to those things that can bring our blood sugar up and increase our risk for developing diabetes. So stay with us, we'll be right back. Let's take a short break.
You mean I can win a laptop or a tablet or a school bag with supplies? Are you dreaming? No, I'm not. It's right here. You can check it for yourself. I need to enter this. I am not missing the alcohol poster awareness competition.
All you need to do is create a hand-drawn and colored poster with the theme "Alcohol-free is a great way to be." Include a 100-word description explaining your poster on the benefits of being alcohol-free. It must have no violent images. Think positive. Open to all youth from 11 to 16 years old. Entries must be submitted to the Substance Abuse Advisory Council Secretariat on the corner of High and Drizzle Street, or the Bureau of Health Education, Ministry of Health, Waterfront Castries, by Monday, November 24, 2025. For further information, call telephone number 468-7921.
Alcohol-free is the best way to be.
Every bed in our hospitals tells a story of someone's mother, someone's brother, someone's friend. And when that story of care is complete, it's time for the next chapter, home. But too often, discharged patients are left waiting hours, days, weeks, sometimes months, not because they want to stay, but because no one comes. We understand life gets busy, but every extra day they wait means another patient, perhaps in pain, perhaps in crisis, can't get the bed they desperately need. So when the call comes that your loved one is ready, please be ready too. Pick them up, bring them back to the comfort of family, where healing truly continues. Because caring doesn't end at discharge, it continues with you. A message from the Ministry of Health, Wellness and Elderly Affairs.
Thank you for staying with us. Welcome back to the Wellness Hour. I am Delphina Vuna, and here with me is family nurse practitioner Shirlene Duncan, and we're speaking about diabetes screening and management. So as you know, we do have quite a few patients, I should say quite a lot of patients living with diabetes in St. Lucia, and Dr. Cyril last week would have mentioned when we did that step survey, the number of persons who were found to have elevated blood sugar, not aware, and also how much diabetes contributes to morbidity and mortality. So that means sickness and death in St. Lucia overall. So we want to talk a little bit about managing. So for someone who has been diagnosed, Ms. Duncan, tell us what are some of the key things that they need to do to be able to manage their condition and live a healthy life?
Okay, so management of diabetes we really need a client-centered approach. So the client usually is at the center of their management, and we have a team approach where multiple professionals are part of managing this client's condition. And so the services that we provide at the facilities, they actually free and high quality, and it requires a number of consultations with your physician and your family nurse practitioner, and thereafter you are referred for a number of services. Now, those services would include support services like your diabetic hypertensive group for support to track your goals. Like if you want to reduce your sugar, you have a booklet provided that is going to help you to determine where you're at now and where you need to be and how you're going to get there. We also enroll you in a 6-week self-management program that assists to give you the tools that you need to manage your condition at home, like monitoring your blood sugar, ensuring that the meals that you prepare are safe and healthy for you and your family. And we also refer you for mental health services to help you cope with, sometimes it's a new diagnosis for you, or maybe you've had it for a long time, but you have gotten to a place of depression that you're out of control and you don't know what to do. And so your mental health practitioner is also available to help with management. We also refer for support services for smoking cessation. So if you are diabetic and you are a smoker or you drink alcohol, as you heard earlier on, that alcohol is also a risk factor for diabetes, to help you to reduce your risk for complications of diabetes if you are diabetic. Your nutritionist is also here to help you plan your meals. Your pharmacist can serve as a means of helping you to manage your medication adherence, encouraging you to take your medication, how to take it, how much you need to take medication. And definitely you would have to be referred for lab investigations. And most of those lab investigations would be geared at ensuring that there is no organ damage or dysfunction. So we would have to do your liver function tests. We would have to also assess your kidneys to see whether you have any complications of kidney disease or have developed kidney disease. We will also be looking out for the percentage of your blood that is carrying hemoglobin in the last 3 months to help determine how high that is and to guide as to whether we need to adjust your medication, you need to change your lifestyle, and to provide some further support. We also refer you for your diabetic retinopathy screening, where you go to one of our facilities, meaning where you have to get your eyes checked out. So they will put you through a camera where you will look into this camera and they will take a picture of the back of your eyes, and they will note whether there's any bleeding or any enlarged blood vessels that may put you at risk for blindness. We also refer you for services that have to do with your dental hygiene. So we have various dental care centers in our facilities that have to do with cleaning of your teeth or assessing your gums to look for periodontal disease. We refer you to the podiatrist to assess whether your feet would need any care in terms of the length of your nails, if you have any cuts under your feet, noting your pulses in your feet and any nerve damage. We would also have to refer you to specialized care in the event that you are uncontrolled and you have developed other complications. So we have an internist in our system where we can refer you to determine whether you have any enlarged heart, any issues with any organ systems that have been failing, and also your cancer screening for men's health and women's health, like assessing to see whether you have any prostate cancer or cervical cancer, and these are all services that we provide. But most importantly, we try to ensure that you have training in terms of self-management as to how to care for yourself at home. So how you would prepare your meals, ensuring that you take your medication every day and correctly. These are some of the main ways that we ensure that you can manage your condition. And we want to encourage persons living with diabetes to attend your diabetic support groups. These are the times when persons who have diabetes can share their experiences, what they have been going through, what they do to control their blood sugar. And it might also be a time to, to de-stress, have a good laugh with somebody you haven't seen in a long time, a colleague, a friend, somebody. So these are some of the services that we provide that help to manage persons who are diagnosed with diabetes in our primary healthcare system.
All right, thank you so much for that comprehensive overview of care of our diabetic patients. And as you can see, it's a multidisciplinary approach. We're not just looking at the blood sugar in isolation, we're looking at the entire body and how the blood sugar or the elevated blood sugar is affecting us, and all the different factors that we need to consider to ensure that you remain healthy and can live with the condition. And Dr. Sia was mentioning this last week on her program that there are many persons that you see who have diabetes and they live very full, healthy lives. Yes. Because they manage their condition properly and effectively. They take control of it, and as Nurse Duncan mentioned, sometimes we have difficulty with patients who don't fully accept their diagnosis, and that makes it difficult for them to be actively involved in their care. And as a medical practitioner, I think that that's one of the most important things. When you as a patient understand what your condition is and what you need to do to take care of it, it makes such a big difference, because I could write you 10 prescriptions for the medication. If you don't think that you need to take it and you don't take it, I'm of no use to you. It really is up to, every single one of us as a patient to do what we need to do to take care of ourselves and to be fully responsible for our health. Because as the medical professionals, the other practitioners, we can help you and we can work with you. And it's very encouraging when we see patients who want to take that active role, because their outcomes are so much better. They're usually the ones who are better controlled. Their diets, they're usually following it. They're doing the exercise because they understand and they're more heavily involved. So I would definitely encourage, to the self-management program really helps you with that and helps teach you some of those things that you need to know in terms of preparing your meals, how to do the monitoring, when to do it, what you need to record, why it's important to bring it in when you're going to the facility, and, yes. And that's really crucial. Do you want to expand a little bit on the actual monitoring, the blood glucose monitoring for the patients at home?
Yes. Okay. So one of the key things is in terms of management of diabetes is self-monitoring. So we encourage our patients to access a glucose monitor. Mm-hmm. So at home they would be able to monitor their blood sugar and to write it down in maybe the doctor's book or some form of documentation, and that when they come to see the doctor or the nurse practitioner, they can present their findings, and that would also help us to know how your body is responding to certain foods. It helps us to know whether you are making good decisions about the foods that you chose and that your blood sugar is being controlled or not controlled. It also provides the patient with a track, can know whether they are, they have this thing under control, or whether there is a need to adjust the medication, adjust their lifestyle, and so on. So we encourage the persons with diabetes to try to, do a finger prick before meals, at least 30 minutes before meals, to see how high the blood sugar is at this point before they decide to eat. And then it will also help determine what they would eat for the day, and the foods that would either increase the blood sugar or the foods that would keep the blood sugar at a more controlled level. And so persons who don't have a monitor at home, it would be good to purchase one at our local pharmacies. One of the things that we have been lamenting over is the provision of monitors for our patients once they are diagnosed, but our system sometimes is not able to always provide those resources. But if you have persons living overseas who can help you access one of those monitors, you have somebody who wants to give you a gift and you are diabetic, you can say, well, you can gift me a monitor because I want to make sure that I'm monitoring myself at home. So when I go to my doctor or my nurse practitioner, they can see that I have been doing what I need to do. Or if my sugar is high, they can recommend some other measures to help me. And so we encourage that self-monitoring. As I would have said earlier on, the client, the patient, is the number one person in the team of management for diabetes. And you should be able to be empowered to monitor yourself. If you are afraid of the prick, you can ask your daughter, your son, your neighbor to help you. But we try to encourage persons to learn how to do it, so that in the event there's nobody, you have no excuse, but you can do it for yourself.
All right. Thank you so much for that, Ms. Duncan. I think also you mentioned mental health, and I think that is one of the things that's also an important part of the management, and also for family members. So, if you have a relative or one person in the household who has been diagnosed with diabetes, it's important as a family unit for us to be supportive. So, for example, you don't want to ostracize that person and say, okay, well, this is your food, you're the one who cannot eat this or cannot eat that. That's not very nice. And it means that if you, for example, say it's the mom, if the mom has been diagnosed, it means that the other persons in the family are at risk, the children are at risk. So you want to start that healthy lifestyle from as early on as possible. Yes. When you're cooking your meals, if she's going to be exercising, you're not going to let her go and walk alone. As a husband and a partner, you want to be supportive, and you want to go and walk with her, and you bring the children, and you do what's manageable. So how can relatives support their family members living with diabetes?
Okay, so most of the time when patients come to see us, they come sometimes alone, and we encourage them that sometimes come with the person that you think is going to help support you in that journey, in that process. So it can be your daughter, it can be your neighbor, it can be your husband, it can be your wife, it can be a sister. We encourage you to come with this person, so the person can basically have an understanding of what is actually happening to you, and to pledge that they would be supportive of you going through this journey. We also have a program that is designed for persons living with diabetes as well as their carers or support persons, which is the 6-week self-management program, where this individual, their family support, or their friend or their support person is taught how to support them through the process, what the meals are supposed to be like, how to do the finger pricking, how to encourage them, how to coach them into being more motivated to control their blood sugar. So it's a very extensive program. It has been offered across the island. We recently had a few new trainers, so they are at your disposal right now. Every region in St. Lucia would have a group of trainers who actually know how to implement the program and to impact those of us who actually are diagnosed, as well as those who are caring for us. So that this program actually is almost like an empowerment for both the patient and their support person. And so if you know that you have a family or relative who has diabetes, offer yourself as a support person. Attend clinic with them when they need to, or ask them how are things going, check in on them, because sometimes it can be very difficult to manage diabetes, and persons can get depressed, they can have other mental health issues. And so we offer mental health service through our mental health nurse practitioners. We have community mental health nurses as well, who can provide some form of counseling to help provide the tools to help you cope with the diagnosis, management of the condition, as well as the support person assisting throughout the process. Because some persons with diabetes, their support person can feel that the person is a burden to them because they have to go and get their medication for them, they have to bring them to the lab, they have to bathe them sometimes, they have to take care of them. Some of them, the patients are bedridden, and so the support person can feel overwhelmed. And so we actually have services available for support person through the self-management program, as well as mental health services that you can access through our system. Our system is, we practice confidentiality, so we will not be broadcasting that, oh, you are here because of this person and so on. But we have trained persons who are skilled and equipped to provide services for support persons as well as persons living with the condition at this point in time in our system.
Wonderful. So you could see that program is very beneficial, not just for the patients, but also for the family members and the carers. Let's touch a little bit on medication. So almost all of our diabetic patients need medication to manage their condition effectively, adequately, sufficiently, whatever word you want to use. But for them to be well controlled, need to be on some medication. Let's talk a little bit about the importance of the medication, adherence to the medication. We have patients who would be like, oh, I checked the blood sugar this morning and it was okay, so I didn't take the medication. Or, you know, I didn't eat yet, so I didn't take the medication. And many other reasons why they didn't take the medication, or they don't take it every day. Let's talk a little bit about the importance of the medication as part of the management of diabetes.
Well, Doc, this has been a sore point for us in St. Lucia because, you know, we have the influence of traditional medicine in our system, and our patients usually believe that the traditional medicine is the preferred choice for controlling their conditions, and so they go ahead and they drink waters mixed in certain herbs, and they decide to abort using the medication prescribed by the physician. And I am one who actually believe that natural is the best. However, the challenges we have in the system is that people do not know the content or the amount that is in those herbal medication. And so it can be causing damage to their liver, their kidneys, and so they're not realizing that, and they have decided that the doctor's medication, the nurse practitioner's medication is not the best thing for me, it's going to build up in my system, or I'll take it if I'm feeling ill, and if I'm feeling well, I don't need to take it. And these are some myths that we need to debunk across our island, and we need to encourage persons to partner with your physician, partner with your nurse practitioner, partner with your pharmacist, because compliance for medication is very important in the management of your condition. We have persons who are actually compliant to the medication, and they can say today that they feel healthier, they feel happier, they are well controlled. And so those who are not taking the medication controlled, meaning that their blood sugar level is much higher than it actually needs to be. And taking your medication actually prevents complications of diabetes. The higher your blood sugar content, the greater the risk of you developing things like blindness, kidney disease, nerve damage. And so if it is that you have chosen not to take the medication, it would be good for you to mention to your doctor or your nurse practitioner, this is what I have decided to do. And they will be able to tell you, okay, if this is what you have decided to do, let's monitor your blood sugar to see whether what you have decided to do is going to impact control of your blood sugar. Also, if you take your medication as prescribed, it improves the quality of life that you live. You live a longer life, a healthier life. You would also enjoy less hospitalization. We find that patients who are not taking the medication, who are uncontrolled, we find that most of the times these people have to be hospitalized for blood sugar control. They have other complications. They stay in the hospital longer. And so most of the country's resources is spent trying to control blood sugar rather than to prevent diabetes. And this is an area that we as practitioners have been working very hard to see how our patients can understand the relationship between taking the medication as prescribed and control of their condition.
For sure. But definitely so important and a crucial part of the management. It's going to be impossible to control the blood sugar for the majority of our patients without medication. And so It's very important for you to adhere to the prescriptions and what has been recommended by your doctor. What I always encourage persons, if you are experiencing side effects, if you are uncomfortable with a particular medication, you're getting upset stomach, you're getting nausea, you're getting diarrhea, whatever it is that you're experiencing, the best thing to do is to speak to your healthcare provider, speak to your doctor, let them know, you know, when I take the medication, I'm experiencing this or that, and is this possibly because of the medication? Is there anything we can do? Can we make any change? And 100% of the time, pretty sure we can make some change. We can give some alternate medication. We can change the medication schedule. There's some way that, because we don't want you to be uncomfortable. With the whole aim or the goal is to have you living a healthy, full life. So we don't want you suffering anyway and having to deal with any adverse side effects. So speak to your healthcare provider if you have any concern, so that we can make some changes to ensure that you are comfortable. Okay? So Ms. Duncan, we're running out of time. Do you have any final words, anything to say to encourage our patients out there to get their screening done, to manage?
Yes. So I want to say to St. Lucians that the services offered in the primary healthcare facility is of high quality. I know that some persons have stigma and they have challenges coming to our facilities because they say you have a longer wait time, and you know, I mean, like everything else, we have some challenges, but the services and the care that we provide is of very high quality. And we offer services in screening for diabetes. As you have heard, that there is a very simple tool that you can use to determine your risk, and thereafter we will take it from there to give you some treatment plan. It doesn't have to be medication, but it can be lifestyle change. So don't be afraid to come thinking that as soon as you diagnose, we're going to start you off on medication. It may mean that you are in a phase where, like, pre-diabetes, and you just need to change a few areas of your lifestyle that would help adjust that. We also want to invite our workplaces to invite us for your workplace wellness activities. We can come to your workplace to screen your employees right there, because we know that sometimes the employees don't have time to come over to our centers to get screened. We also offer services at health fairs where we screen for diabetes. We provide health education for our Bureau of Health Education, our health educators, our nurses, all our practitioners are well trained to provide health education to help empower you. But for those persons living with diabetes, I want to let you know that you are not alone. There are multiple persons in St. Lucia living with diabetes and living healthy lives. It means that you can live a healthy life too. But we want to partner with you. We want to put you at the center of your care to develop an individualized plan for you to help manage your condition and help you feel that you are in control of yourself. So diabetes is a condition that affects almost every family in St. Lucia. And so we want to let you know that our primary healthcare practitioners are ready and willing to support you to provide the services that you need. Just present yourself and we will be there for you. Thank you.
All right, thank you so much for that, and thank you so much for joining us here on the Wellness Hour. Such a fruitful discussion, and I'm sure the listeners will agree. And a lot of the things that we spoke about today in terms of the lifestyle and some of the general changes apply to so many other conditions. So when we speak about high blood pressure, we speak about the same things. And we know there are 5 main chronic conditions. So we have the high blood pressure, the cardiovascular diseases, we have diabetes, we have the chronic lung diseases, of course, mental health also considered to be a part of that. And all of those things, like the healthy diet. So again, going back to our My Plate, a Healthy Plate, avoiding smoking, alcohol, including exercise or physical activity into our daily lives. All of those things are repeated for each one of those chronic conditions. So crucial for us to take that bold step and to make those changes in our lives. And as we said, simple steps, adding on every day. You know, you want to know that with every day you're getting better than you were yesterday. We're not trying to make a dramatic overnight change. We're trying to make a change that we're going to be able to maintain for the rest of our lives, and that will help us to improve the quality and the quantity of years of life that we have. So we're going to start with our little kiddos, encourage them, and continue throughout our life. Just before we wrap up, so we're speaking about diabetes, and tomorrow is actually November 14th, which is World Diabetes Day. So we want to encourage you. Every Friday in November we are wearing blue, but especially tomorrow, since it's the actual day, for diabetes awareness. And again, the theme, diabetes and well-being. We want to all wear blue. Be sure to snap, post, and tag us at the Ministry of Health. We're on Facebook, we're on Instagram. Send us those pictures. Show your loved ones that you're supporting them. Bring some awareness to persons who may not know. So if somebody sees you wearing blue, you know, at your office tomorrow or something, you can say, hey, I'm wearing blue in observance of diabetes. You know, share with somebody, let them know so that we can all support those around us. We can bring more awareness. We can encourage persons to get screened, and that is going to go a long way in helping us curb this epidemic of chronic conditions that our country is facing. So of course, we're looking forward to seeing those pictures tomorrow. I'm saving my blue for tomorrow. And of course, you've seen us definitely had to wear her blue, right, to represent.
And with my pin as well, my diabetes pin. And, right here.
And of course, a reminder for the SACS alcohol awareness competition. And we do encourage our children. We also, you know, we want to ensure that our kids have creative outlets to do things. So this is definitely an opportunity for them to do that, and also to bring awareness to the effects of alcohol. So I'm looking forward to seeing some nice submissions for those. So thank you so much for joining us on another episode of the Wellness Hour. Thank you to the Hot 7 team. Thank you to the Ministry of Health, Wellness and Elderly Affairs, the communications team, and especially Onika, who is always doing such a great job putting together the content for the show. We look forward to the next program, and we will see you again. Do have a wonderful rest of the week.
Hot 7 TV is the rising star of television in St. Lucia with our stunning 100% HD quality, fresh exciting programming, including a balanced professional newscast. We are now the fastest growing TV station in all time slots on cable. Additionally, over 10,000 households carry our plug-and-play antennas. Our mobile app has over 11,000 users locally. Keyword to find